You're watching Beyond Market. Welcome. I'm Esther Awoni. Many thanks for joining us. On today's show, we'll explore ways to drive human capital development in Nigeria. As always, you can be part of today's conversation. Just send tweets to @CNBC Africa. You can also send tweets, send your comments, send your thoughts to my Twitter handle. It's at Esther O. Awoni. Now, the World Bank says human capital development will be the long-term investment that any country can make for the future prosperity and quality of life of its citizens. Meanwhile, UNICEF data shows that over 10.5 million children in Nigeria are out of school. So what steps can be taken to reverse this narrative? Umar Mantu, founder of Manumar Foundation, joins me for today's discussion. Umar, thank you so much. Pleasure having you on the show today.
Thank you for having me.
Now, you and I were talking earlier about the World Bank's Human Capital Index. We see it every year. And I'm remembering that of 2018. I mean, there was a statement from the World Bank where it said, look, again, Africa, not just Nigeria, the entire continent continues to rank at the bottom. We're seeing health, education, rural, just general human capital outcomes still being poor. Now, the question always is, which level of government has the biggest impact? Many times here in Nigeria, we always talk about, what the federal government is doing or not doing. But, many times we always say that rural development, community development, health, education, whatever the sector, is the government that's closest to the people, the local governments, the state governments, that have the most impact. But let me hear your thoughts, your perspective. When you see these numbers, you working on the ground with your NGO, which we'll talk about later, just share your thoughts on the outcomes that we continue to see.
Well, thank you very much for having me today, like I said. It's not a lie. The World Bank Index on Human Capital as of 2018 showed that Nigeria ranked 152 out of 157 countries. And also from that particular index, you could see that there was, out of the 85 million people in the labor force in Nigeria, we only had about 7.14% of those people working in one industry or the other, which is an absolutely abysmal figure if you ask me. And going back to what you said, yes, the closest to the people are the local governments and the state governments. And if you look at what is happening in Nigeria today, a lot of the local governments and the state governments are not funded enough. They don't have enough skill to be able to train or take on the actual needed effects to be able to impact the people down to the grassroots level. When you look at things like primary health care, you look at things like education, basic, primary and secondary, in other communities in the world, when you look at Asia, you look at Europe, those things are responsibilities of local governments. But Nigeria today, because, we are a federal government in theory, but in reality, you could say we're a unitary government because everybody from state government to local government goes all the way down to federal government and waiting for what is the federal government going to do before we can take on impact. So for now, I think we need to invest heavily into our local governments and state governments because they're closest to the people.
When you say we, are you talking the federal government or are you talking
Nigeria as a whole?
Private sector, because many times, obviously, the private sector comes in. We have, of course, NGOs, non-governmental organizations. Yes. We have private sector. We have donor agencies, across different countries who come. But I just wonder sometimes, for how long? Because at some point, obviously, because right now we're talking about African solutions for African problems. Africans solving Africa's problems, and it's part of it. If we're going to have a youthful population that's more than half of the continent in the year 2050, obviously investments need to be made now. Absolutely. And we need to be the ones who make those investments. So, and those questions just go through my mind when we're talking about health, education outcomes, and funding, which is obviously, like you said, is quite crucial. Are you concerned that we will continue on this path? Because every year we talk about funding, and the funding doesn't seem to come.
Well, thank you very much.
Not to sound hopeless here.
No, you have. The truth of the matter is you have every right to say what you're saying, because if you want to look at moving in the direction of positivity or moving in the direction of progress, and then, I'm not a public policy analyst, but I'm a Nigerian and I can see if you're moving into the 2020 budget coming forward and we're talking about funding and we're talking about issues, you can see that still Nigeria, based on the proposed 2020 budget coming in, we're still not funding enough education and healthcare. When you look at according to the United Nations and some of its agencies, you're supposed to spend at least 26% of your budget on education. And you look at the current budget that was proposed, and you look at from the universal basic education to the education funding itself, it's barely 150 billion naira that is being spent on education, which is nowhere near 26% of a 10 trillion budget. And when you look at things like healthcare, where the World Health Organization has said a minimum of 5 to 10%, give or take, forgive me, don't quote me on that stats, but I know it's about between 5 to 10% or so you're supposed to do of your budget. And when you look at what's happening on healthcare in this particular budget moving forward, you're barely spending almost 50 billion on budget. So it still doesn't look like Nigeria wants to take the step moving forward. So we're urging the government to please move forward and increase human capital expenditure. You have a 10 trillion naira budget, and the numbers are just very, very small when it comes to education.
Let me ask you this: would it be, yes? I mean, there is no doubt that the government is cash strapped.
Yes.
That there's no doubt. Would you say, but that to some extent is still a priority issue, even
I
if
agree.
We are distributing? Yes, there isn't enough to go around for different sectors competing for different But in terms of how we're allocating this, do you think that priority still goes into the mix?
I agree with you. It's a priority issue, because if you even look at in the past 3 cycles of the current government that we have today, they have said they have spent over 500 billion on social investment programs, which I feel is a direct impact on human capital. And then in this current one coming up, they're showing that they're going to spend about 30 billion, which is almost a 94% slash on human capital investment if you want to look at, vocational skills training and school feeding and all those type of things moving forward. So it is, in my own opinion, from what I can see, a priority issue. The government, yes, wants to focus on infrastructure, which is good. But if you look at Bill Gates, the richest man in the world and founder of Microsoft, said that you can't have good roads without people. And at the end of the day, if you do have the investment on infrastructure has to go hand in hand with investment in human capital, because the world is shifting towards technology-based knowledge like ICTs, telecoms. So you need human beings who are skilled and are healthy and are educated to be able to run these infrastructures.
Do you think that's where the problem lies for us? Just being able to, because many times when you're investing in education, you're investing in humans, the returns are not immediate many times.
Absolutely.
And in a way, but when you invest in infrastructure, you build a road, you see the road immediately. So you get, sort of, in a way, return on investment because it's there, the physical asset is there. But for education, you want to invest in a child primary school up until tertiary education, but you don't, it's long term. Do you think that also is some kind of a barrier?
Well, it is some type
in the priority process.
It is some type of barrier, but then again, I want to ask you a question. From the last conversation that I think that our Minister of Works had, and he said we have over 600 federal roads that need some type of rehabilitation or reconstruction. And if you decided, for example, I'm just saying, you wanted to fix all 600 roads, it's not going to be immediate, is it? It's going to take time as well. You're not going to fix all 600 federal roads in Nigeria over one night. And we don't even have the money to even do it. Imagine if you decided to allocate 1 billion to every road. You need 600 billion to do that. So it's going to take time as well. So it should go hand in hand. It's not that one should be 80% funded infrastructure and then 5% or less than 5% funded on human capital.
Let's move this quickly along. So let's not dwell too much on that.
Okay.
So there's a gap. And, conversations have always been, let's bring in the private sector. NGOs are there, we have donor agencies. But we're seeing a bit of donor fatigue, especially for some of the international agencies, which is to be expected with all the protectionism and, of course, the global slowdown, economic slowdown that we're seeing. Would you say that the private sector, is there a realization? Is that message out there that the private sector in this regard needs to do more, needs to step up more for better outcomes?
Absolutely, I agree. The private sector definitely needs to spend more, even for their own benefit. At the end of the day, most private businesses are there to make profits. And then there is an empirical study that says when your human capital is well-skilled and well-incentivized, you get more economic growth. So naturally, I feel the private sector needs to invest a lot in skill training for their staff, and even outside that, there's CSR programs to help people, because at the end of the day, I can't remember, but there was FSS Financial System Strategy 2020
yes.
document that was done a couple of years ago, and it showed that I think children between secondary school age were about 33 million within that age, but only about, I think, I can't remember the exact figure, but only about like 7% passed JAM during that time. And so that should, give or take, the number came about 1.3 million graduates of secondary school age was all we're bringing out every year as a nation. So even as private businesses, you don't have much of a pool to be able to tap into to employ. So private sector definitely needs to invest a lot into human capital.
Speaking about
for their own benefit.
Speaking about investments, let's talk about the Umar Foundation. You head that foundation. Talk to us about, I mean, what your focus is, what this foundation does, and more importantly, your focus areas.
Well, the Manumar Foundation is a non-governmental organization. It's a non-profit organization. We focused mainly on improving the quality of lives of Nigerians and Africans where possible. We focus on healthcare, and in healthcare we focus on child and maternal health. We try to come in where possible to provide birthing kits and mosquito nets for women who are pregnant and about to give birth, because we feel that that is the basic beginning of life, where women give birth and then eventually we move on to focusing on the vaccinations that they give to kids, because we feel that if you have that basic need met from when you're born to when you have good vaccination, it can take you to the next step, and then which is education. So with education, we focus on primary and secondary education. We build classroom blocks, renovate classroom blocks, provide materials and things like computers, exercise books, where to the lowest community, not schools that are funded. We go to community-based schools in order to encourage those communities to go to school. And then also sports. Sports is more of because we see the one time Nigerians are really happy is when they're all supporting sports and there's unity. So bring about peace among people, reintegration, so we don't have those socio-political, socio-economic divides within ourselves, ethno-religious divides and things like that. And water and sanitation as well, and community development where we can, and skills acquisitions.
Speaking about, I mean, you mentioned water and sanitation. Nigeria, I'm not sure if you're aware that Nigeria just became the #1 country that practices open defecation. I mean, that was quite heartbreaking to hear. And, I know that a lot of work has been, going on the ground to fix this, but to now surpass India and become #1, this begs the question, are we moving back? Are we not doing enough? Is population growth, is that a problem? What is the problem? I
mean, I think it's all combined. Population growth definitely isn't helping the situation, because they're saying Nigeria is growing between 3 to 6% yearly every year.
Well, 2.83%.
Sorry, but yes, between 2 to 3% every year we're growing. So population isn't helping, but then again, there needs to be mass reorientation and mass education on the people of the importance of water and sanitation to their health.
Umar, I must thank you for your time so far. We're just going to pause here, come back, and then continue from where we left off. I've been speaking to Umar Mantu. He's the founder of Manumar Foundation, looking at, of course, a human capital development and how we can have better outcomes in Nigeria. We're continuing our discussion on ways to drive human capital development in Nigeria. And still with me is Umar Mantu, the founder of Manumar Foundation. Umar, thank you for your time so far.
Thank you very much.
Speaking from where we left off, we're talking about water and sanitation and the fact that some of these basic amenities are not being provided. And you would also mention that some communities that you've been to actually cut off completely from the world and from this. But for the Manumar Foundation, talk to us. What specifically do you do? In what ways you support these communities?
Well, in terms of water and sanitation, we as the Manumar Foundation have done in the past 3 years, we've provided over 14 different water stations and boreholes in different communities across Nigeria, from Kwara to Nasarawa State to Plateau State, where predominantly most of the work has been done. And we try to talk to the people on the importance of guarding and protecting these boreholes or these water stations that was provided for them, because it's for their communities and it's for their own need, and they need to protect it as well, because some of these places and some of these communities, unfortunately, due to the level of poverty or hunger, they go and they probably destroy some of those things, and then they sell some of those parts, even when they're provided for them. So we try to educate them in terms with their chiefs or their local chiefs to tell them. But yes, as a foundation, we try as much as possible to provide where we can with the resources that are available to us. We do a needs assessment. We have ambassadors on ground on the Manumar Foundation for different communities. So
What do these ambassadors do?
So basically, before you become a Manumar Foundation ambassador, we take you through what is called a leadership training for a week.
Okay.
And then within that week, and you have to be between age 18 to 30.
Okay.
And then within that week, you go through training from skills acquisition to basic literacy to see your capacity as an individual and how you can come in also. And then from those communities that we work in, that's where we pick our ambassadors, so that when they go back, they can preach the gospel of investing in humanity and taking being your brother's keeper and thinking of the next generation. Because eventually we want the work to be sustainable. We don't want a situation whereby if Manumar Foundation is over, then there's no...
They put one borehole and then you're gone and then
exactly,
that's it.
and then it's over. So we want a continuous process of following up with it so they can go and check up on it.
So is that system working?
Well, so far so good. So far so good, because like I said, we've done work in over 3 states and in over 15 different communities. We can't be everywhere at the same time.
The system of the ambassadors.
Yes, it is. That's what I'm going there, because so some of these ambassadors are based in those communities, so that they can give us feedback of how things are working or how is it working, so that when we're moving to the next area, we would know, because we've had different types of water station and different type of boreholes. Some communities, we know that if we put a hand pump borehole, it works better for that community. Some other communities, if you put electric one with generator, they will not manage it because it's a problem for them to even afford to buy diesel to pump those things. So with those ambassadors on ground, it helps us manage and keep track of the progress of the work that we're doing in terms of water and sanitation.
So would you say that there's also a change of mindset? Would you say that's also happening with those ambassadors? Or
I believe there is.
But just keeping it, or it's just to keep the asset intact and safe?
I believe there is, because recently now I had one of my ambassadors recently who, it had nothing to do with water and sanitation. She owned a salon after one of her training, because one of the trainings that we taught her was how to do makeup, nails, and hair. And then now she is called the Betiva or something, Betifa. And then now what they did is she now decided to use her own salon of her own choice, and now came to us to help her in sponsorship. And then she now ended up training another 10 ladies in the same thing that she's learned from. So I believe that the culture is starting to work and resonate with our ambassadors, because we've had at least 5, because we have about 30 ambassadors now, and we have about 5 of them who have come up with different projects that we've been able to help them in terms of economic and community development.
Were they mostly women?
Absolutely.
Yeah, I guess I was going to go, not to sound the cliche or corny here. I mean, just that, statistics prove it. I mean, empower women, and then, of course, she has the ability to,
Fortunately,
the ripple effect is always there. Let's move on to maternal child mortality. I mean, I know this is, it's a sticking point, not just for the government, across the board. And, the fact that you live in a certain part of the country shouldn't determine how your experience in terms of bringing life into the world, but we continue to see our numbers still being quite poor. Talk to us about the work that you do in that regard.
Well, as of the last statistics I checked from UNICEF, maternal mortality rate was Nigeria accounted for about 14% of global maternal mortality rate, which is large, abysmal. I don't want to use the wrong words here, but 14% of global maternity mortality rate. So what we decided to do now is, as Manumar Foundation, we got partners like Silver Lining for the Needy Initiative and other partners like Rotary International, who we've partnered with to be able to provide an intervention, somewhat of an intervention or relief to the lowest community. So what we do is we provide birthing kits and we provide mosquito nets. And in these birthing kits, they contain all the basic things that we feel a woman needs when she's in her last trimester to go and give birth. They have blades, umbilical cord strings, to the mat, to the antiseptic soaps, to the gloves. It's all contained in one birthing kit. And that birthing kit, and then we know the problems with malaria concerning pregnant women as well. So we combine these birthing kits with, as well as the mosquito net, and then we give women in their 3rd trimester. So how do we do this? We don't just wake up and say, okay, which women are here? We go to primary healthcare centers, because we also want to encourage people to come and register in the primary care healthcare center so they can give birth in the hospital versus at home. And then we also try as much as possible to subsidize or make free possible where we can, based on the women registered at the primary care healthcare centers, for them to come and give birth for free, and then we provide them with these mosquitoes and birthing kits. All they have to do is just come with that birthing kits on the day that they're in labor, and we paid for them to be able to give birth, and then they give birth. And then after that, we follow up on those women. We don't just say, okay, so we can track how our birthing kits are working. How many women did we give this thing actually came and used it to give birth? How many women are registered on the primary health care center list, and how many women have come after to be able to follow up on things like that. And then after they've given birth to the children, we try as much as possible to encourage them to vaccinate their kids, because we still have women till today who do not vaccinate their kids. And
do you find it to be more a cultural barrier?
It's a cultural barrier, as well as it's a lack of knowledge barrier as well, because the truth of the matter is a lot of these women do not know
in the first place
any better. And recently Nigeria is soon going to be polio free as a nation, so things like that are very important. Vaccinating, we've gone almost 3 years now without a new case, or 3 years now without a new case of polio, and hopefully by very soon, any day from now, we'll be
completely polio free. Let me ask you this: what is the big picture for the Manumar Foundation?
Well, the big picture for the Manumar Foundation is to be able to invest in humanity. Invest in humanity in terms of invest in humanity in terms of human capital development, in terms of healthcare and education. I believe Maslow's theory of hierarchy. If you provide basic needs for people, people will find means to self-actualize. Human beings are adaptive. Human beings are very resilient, especially the Nigerian human beings, the Nigerian people. You know, they're very resilient people. They're very innovative. They're very creative. But if you allow Nigerians and you provide them their basic needs, from education to healthcare as well as vocational skills training, I believe we'll be able to develop more as a nation by providing to our increase in GDP and economic growth as a nation. So, in other words, the Manumar Foundation wants to vigorously come in, help the government, as well as help and encourage private sector individuals to invest in our humanity through education, through primary healthcare opportunities, sports, as well as community development in terms of water and sanitation and any other.
Now, so many other NGOs also plugging into the Sustainable Development Goals 2030. We're inching closer to that date, and I don't know. I mean, looking at the numbers, it's still not encouraging, but it's also good to know that work is continues. There's work on the ground, and there's so many NGOs that have plugged into it. I mean, how hopeful are you that come 2030, when we get to the expiration date, Africa would at least have some very good numbers to show for all the hard work from both the private sector, the NGOs, the government, to show for all that work that's being done on the ground?
Well, how hopeful am I? I'm absolutely hopeful, because I'm a Nigerian and I'm African, and I have to hope for the best for us to, and not just hope for the best, but actively work to see how we can achieve that collectively. It's not the responsibility of just government. It's not just responsibility of just private individuals. It's not just responsibility of us NGOs. It's everybody's responsibility to see us achieve those sustainable development goals as we move forward, in order for Africa to be the powerhouse that it's supposed to be. So I'm hopeful definitely that we'll reach that. The reality on ground is we need to keep pushing. We need to keep asking. We need to keep requesting from our government for better. We need to keep requesting from ourselves to do better and to consider and to invest. Imagine if one person invested in the one person in humanity in Nigeria by way of education or healthcare. It would go a very long way. So I think it's a collective responsibility, and we all need to put in the work. And as Africa, we need to all our leaders and NGOs, we need to continue to collaborate as we've been doing, because a lot of NGOs collaborate. That's the truth of the matter. We partner a lot. We have a lot of partnerships. I have a lot of partnerships that have helped me reach my goal today. So we need to continue on that. Don't see ourselves as competitors. Instead, we to see ourselves as partners in making Nigeria a better place. And the government should also see us as well as competitors, but we're there to augment whatever they're doing.
But what about funding? Crucial part. We have about 1 minute left.
Funding, we need as much funding as possible.
Funding for the foundation in terms of, obviously to boost capacity, to help you, be more effective with the work on the ground.
Oh yes, absolutely. We need as much funding as possible. Right now, as we are as a foundation, we don't have as much funds as we want to do to achieve all the things that we're doing so far. Fortunately, yet unfortunately, we still haven't. The foundation is still pretty much not where we want it to be in terms of our dreams meeting the funding capacity to meet our dreams. And then we hope that obviously as we keep going on, we'll get more partnerships with the government and grants and be able to apply to do what we're doing so far. But as we are now, the foundation is we still have our main source of funding is still coming from our board of directors, from our trustees, from our personal selves for now.
Okay, Umar, thank you so much for your time today. It's been a pleasure having you on Beyond Markets.
Thank you very much.
I've been speaking to Umar Mantu. He's the founder of Manumar Foundation, talking about achieving better outcomes, of course, in human development in not just Nigeria, but on the African continent as a whole. Well, that's it on Beyond Markets. Thank you so much for being a part of it. Remember, you can watch all previous episodes of the show on our website. It's CNBCAfrica.com. You can also stay engaged with the hashtag Beyond Markets. You can also send your thoughts, your comments to my Twitter handle too. It's at Esther O. Awuni. From myself and the team, it's bye for now.